Hello everyone, welcome to the first video in the series about Theodore Millon and his personality theory. Today's video is about the rationale for the new personology. That is to say that I will focus on his idea and at its final iteration. I will not focus on the development of his thought. I want to present the final idea, but I want to demonstrate it in the dynamics, sort of what were the problems that Theodore Millon was trying to solve, and how he eventually came to his theory. So the plan for today's discussion will be, the first I will say a few things about typology in general, how and why it's important in my practice as a language teacher. And then I will speak about Theodore Millon's critique of other perspectives on personality, and as well as the DSM, Diagnostic Statistical Manual of Mental Disorders. And then I will move to talking about his rationale for creating a new science of personology. And in talking about his theory, I will focus on the polarity model, and yes, I guess I'll finish with just saying a few things about the book that I'll be using. In this conversation, I will be only referring to a paper that he wrote with his colleague Seth Grossman, and the article is called Psychopathologic Assessment Can Usefully Inform Therapy, a View from the Study of Personality, and it was published in the Handbook of Personality Disorders, edited by Jeffrey Magnavita, published in 2004. So when I'll be citing this source, I'll just be saying that it's from the paper. I will also be citing a few things from his book, Millon's book, which is the third edition, published in 2011, and it is called, oh my god, okay, never mind. So, typology. Well, the first thing that's important to note here is that we always categorize things and people. For those who work with people like I do, we usually have some categories, something like easy clients and difficult clients. I had a friend who worked in a bakery, and she had clients who two categories. One that was always choosing, and the other one that was just always buying without really thinking of what he was buying. As far as my teaching is concerned, I tried to come up with the method that would help me understand my students' needs better. And it was quite obvious for me to begin with thinking of how different students collect data and learn from different resources, different types of resources. Visual, so there were of course people who like to see things, who like to see pictures, schemes, graphs. There are people who prefer reading over listening. There are people who prefer listening over reading. I, for example, really enjoy listening to lectures, and when I walk my dog, I always put some lecture on, and sometimes I better retain information than after I've been reading. It's easy anyways. So my rationale of why I started learning about that is to, well, first, when I decided to come up with a method, I quickly realized that there is no one method, and that I would have to come up with a few methods to accommodate to each and every one of my students. After a great deal of research and studying various other personality typologies, I found Theodore Millon, and here's why it's the best for me. The first thing that I like about his theory is that it's simple and it makes a lot of sense. Second is that by understanding the theory, you can deduce all the personality types. And if you're using the DSM, if we're talking about personality disorders, and you're using the DSM, you will have to memorize the symptoms. You will have to memorize the criteria for which you would use to diagnose a person if you're a practicing clinician. But Millon's theory is quite simple again, and by just understanding the theory, the components, you will be able to deduce all the personality types, and you don't even have to use the names. You don't even have to know what it's called, what this type is called by him. You can just understand how the person works, so to speak. So that's the second thing that's good. The third thing is that while he does argue that all the other approaches are limiting, you can still find something from these other approaches in Millon's theory, and you can still use these heuristics to help you understand the person in part, which is good if you're a teacher, because you wouldn't want to analyze the student's past. You wouldn't want to start your language learning path with talking about their past, talking about their close relationships. You can see how they are. You can listen to their stories about their basic everyday life, and that might be enough for a start. And the third point is that by just knowing something and understanding what the person, to which type the person would belong, you can actually deduce. And that's also the argument that Millon makes, is that it's important for a scientific theory to have this quality that those who use the theory would be able to deduce the symptoms, so to speak, that have not yet been manifest. So, for example, if I have a student and the student manifests some symptom, let's say the student has problems showing up on time, and after some analysis I've come to the conclusion that this person would be type A, then I know also that persons of type A also have problems with memorizing new words, for example. So that makes my job a lot easier. And also when we talk about ourselves in our everyday life, when I talk about my students, I don't want to say that they have personality disorders. I don't want to diagnose anyone, but I still want to understand them. So there's something about this theory. Well, it does provide types of a normal personality, but there's also something to this theory, just maybe even the words, the terminology that Millon uses, that makes it it doesn't alienate you from normality. When you understand his theory and you use this approach, this terminology, it's not when you talk to students using this terminology, they don't have a feeling that you're judging them or diagnosing them. So that's why it's good. Okay, and moving on, speaking about typology in more detail, in the contemporary culture we use words like extroversion, introversion all the time. The big five typology is quite known already. Pretty much everybody knows what id, ego, superego is, and people like to categorize. We like to categorize ourselves. So I guess this is the first point in adopting a a typology is that we do use a typology all the time. And the question is, the question will be then, which typology would be best? Which typology would be most scientific, so that we would be able to test it, to test our theories and to make experiments. Yeah, and to make predictions for the future. That's the whole goal. Now, moving on to the DSM. As I said a minute ago, nobody really likes being diagnosed, especially if they haven't come to see the therapist. But if there are some obvious problems in the behavior, in the emotional regulation, the first obvious choice would be DSM. Well, there's a lot to say as far as critique of the DSM-5, as its latest iteration is concerned. And just to give you an example, Millon in 2012 published a paper which was titled "How did we get into this incoherent DSM personality disorder mess, and where do we go from there?" A commentary on Blashfield and Reynolds, so that was a response article. But the most important points to focus here is that first, disorders in the DSM are grouped and classified by their manifested symptomatology. There are 3 clusters, and they're grouped by how similar they manifested themselves, and they are not supported by a unified theory. The second thing is that there is no solid guidance for treatment in the DSM. And the third thing, it's not all, but just what would be most important here, the third and the last thing, is that because of the first 2, there is often confusion that emerges between different there's a confusion as far as the severity goes. So it's not exactly clear how to classify these disorders in terms of their severity, and because of that and the previous points, there is for example, when cluster B personality disorders are discussed, some researchers say that they're all, that is histrionic, antisocial, narcissistic and borderline, that they're all just variations of one underlying disorder. Okay, and just to cite the direct source, so DSM-5, page 645. First, how it defines a personality disorder, and that's crucial here. A personality disorder is an enduring pattern of inner experience and behavior that deviates markedly from the experiences of the individual's culture, is pervasive and inflexible, has an onset in adolescence or early childhood, is stable over time, and leads to distress or impairment. There's a doctor, Jonathan Helt, who wrote a book called Memorable Psychiatry. He also wrote Memorable Neurology and Memorable Psychopharmacology. He also has a channel on YouTube, and he proposes a mnemonic, TIDE, as in traits become inflexible, disabling and extreme, to cite the DSM again. Enduring pattern of inner experience, deviates from the expectation of the culture, pervasive, inflexible, stable over time, leads to distress and impairment. And 3 clusters, as I said a minute ago. Page 646 of the DSM-5, it says, the personality disorders are grouped into 3 clusters based on descriptive similarities. So this is the key point here, that they are based on the descriptive similarities. Cluster A includes paranoid, schizoid and schizotypal personality disorders, and individuals with these disorders often appear odd or eccentric. Cluster B includes antisocial, borderline, histrionic, and narcissistic personality disorders. Individuals with these disorders often appear dramatic, emotional, or erratic. Cluster C includes avoidant, dependent, and obsessive-compulsive personality disorders. Individuals with these disorders often appear anxious or fearful. It should be noted that this clustering system, although useful in some research and educational situations, has serious limitations and has not been consistently validated. So even the DSM gives a caveat as to the usage of this systematology, of this grouping, this classification. Just to repeat again the clusters using the three other mnemonics proposed by Jonathan Helt. Clusters are weird, wild, and worried. So cluster A, weird. The mnemonic is PASS. PASS as in paranoid, schizotypal, and schizoid. PASS because if you invite them to a birthday party, they would most likely pass, because they rarely, and in clinical settings, they also rarely come to seek attention themselves. They generally avoid relationships. Cluster B, which is wild, or as DSM says, dramatic, emotional, or erratic. The mnemonic proposed by Held is BAND, as in B-A-N-H. They seem okay, but the behavior is often repulsive to others after having been in contact with these personalities. So they will be banned from the parties. They will be invited because they look quite okay, but after having been to this party, they will be banned from the further events. And those personalities are super common in clinical settings. They are marked by high emotional instability. A mnemonic for the cluster C is DOA, dead on arrival, dead on arrival. And these personality disorders are marked by sort of anxiety, at least that's what others would say when they would look at them. Avoidant, dependent, and obsessive-compulsive personality disorders. They resemble anxiety. Cluster B resembles mood disturbances, and cluster A resembles psychosis. Okay, and just a brief remark concerning Millon's classification. So in his classification, in its latest iteration that is used now, he also includes such personalities: negativistic, masochistic, sadistic, melancholic, and turbulent. They will be later discussed in greater detail. So we have seen the differences of, not the differences, but we have talked about how DSM presents these personality disorders in clusters, which are grouped by how they look, but what they resemble. But as we shall see later, these groupings are not only superficial, they are quite, some doctors say that they're quite wrong because the underlying cause is not at all similar or the same. Okay, speaking of Millon's view on classification, so as I said, he added new personality disorders which are not present on the DSM-5, and some of them are actually derived from his theory. They are theoretical derivations, and some critics of Millon say that he might be overindulging in theory, thus adding new personality disorders where there are none, that he tries to accommodate reality to fit into his system. But as we shall see in a moment, Millon has a response to that. And thus we are moving into the third part of this discussion, which is Millon's view on classification. And I'd like to start with the quotation from his book, remember, 3rd edition, 2011. Some authors have shaped their materials in line with narrow theoretical models, for example, neurobiologic, statistical, or psychoanalytic. Inevitably, these works compressed the rich diversity of clinical data into Procrustean bits, discarding what did not suit their author's predilections. In the previous edition, in the 2nd edition of this book, he actually presents these approaches as these schools of thought as different approaches, and he calls them early perspectives and contemporary perspectives. And in the beginning of his book, in the 2nd edition of his book, he tells about the limitations and also about the good sides of these perspectives: the biological, psychodynamic, interpersonal, cognitive, trait and factorial, and then he presents his own evolutionary neurodevelopmental perspective. On the same page, in this preface to the 3rd edition, he states, "I have adapted and refashioned what appear to be divergent views to fit a coherent integrative model that coordinates normalities and abnormalities, as well as one grounded fundamentally in principles derived from evolutionary theory." So he uses all this knowledge, all the data acquired through the decades by these different schools of thought, and but the way of using this data, of applying it into practice, is profoundly different. There is an underlying theory that governs all of it, all of the data. It fits very neatly. And note how he says that, as well as one, that is an integrative model, grounded fundamentally in principles derived from evolutionary theory. His theory is, so he's referring to his evolutionary theory of personality. Before we talk about why evolutionary and what exactly it is, I'd like to present some thoughts of his about the necessity of having any classification. So this paper that he wrote with Seth D. Grossman, called Psychopathologic Assessment Can Usefully Inform Therapy, a View from the Study of Personality, 2004, Jeffrey Magnavita, the Handbook of Personality Disorders. So Theodore Millon there talks about two radical, extreme forms of classifications. The first one he refers to as anarchistic view of classification. That is the clinicians who try to abandon all attempt at classification and giving names to any clinical phenomenon. The opposite he refers to as the cookie-cutter approach. That is to say, the clinicians which, by sticking too much to the protocol, flatten all nuance in the uniqueness of a personality of a given person. And he compares them, he gives this metaphor that in doing so, they become rather a technician than clinician. Millon's general response to the need of classifying anything in any science is that, and I quote, "Any science needs a taxonomy to collect, organize, assess, and operationalize elements of its findings." The theory that he presents is an integrated theory of emergence of a style or a disorder, of a personality style or a disorder, or its development and the assessment and therapy. And he says on page 25-26 that a mature scientific approach to therapeutic intervention must derive fluidly from the taxonomy. While awareness of personal biases may tell us what not to do and what to watch for in ourselves as clinicians in reaction to certain patients, we must also begin to take a balanced and informed view of how therapeutic action may be predicated based on a particular presentation, manifest in a useful diagnosis. So what he's trying to say is that by understanding how personality emerges, we can understand what to expect, and we can form a diagnosis and a therapeutic plan. So we do need a taxonomy. The response to the anarchistic view of those who try to abandon all taxonomy, he says that if the classification is used to label a person, to create and propagate bias and stereotypes, then yes, it's not useful. But in order to collect data, to share it with other researchers and practitioners, we need to have some way of naming the phenomena, classifying them, organizing them, and operationalizing them in order to be able to assess that style or disorder in other people and come up with potentially successful therapeutic plans. So, as he says on page 27, the question that must be raised is whether placement in the category impedes or facilitates a variety of clinically relevant objectives. Thus, if this grouping of key characteristics simplifies the task of a clinical analysis by alerting the diagnostician to features of the patient's past history and present functioning that he has not yet observed. So, again, I think I mentioned it already. If we know what the type is, we can guess what other symptoms might emerge next. It often happens, I think, when a person tries to fight when anybody tries to get rid of a personal habit that this person doesn't really like, and in doing so, this person substitutes one bad habit with another one. That's just an example. But if the person were to try to understand the underlying structure of their own personality, why he or she picked up this bad habit, then they might come up with the better solution on how not to take on any habits rather than just changing one habit with another one. And I will finish the quote. Furthermore, as it has been argued here and elsewhere in Millon 1988-1999, we must, as a profession, understand that the methodology we utilize should not stem from our particular emphasis of training. So again, that's the reference to clinicians who have been trained as psychodynamic practitioners. They would mostly adhere to their psychodynamic models, or behaviorists who, as Millon says, will never accept personality as a construct and will therefore not acknowledge access to formulation. Access to is the personality disorder section in the DSM. So, as we said earlier, DSM-5 groups personality disorders in categories which are where each disorder resembles another one in the same group by their manifest symptoms. And on the other hand, we have practitioners who will try to, like psychodynamic practitioners or humanists who will try to, as Millon says, put their patient into a Procrustean bed, so to speak. Then, again, as Millon says, page 26, in essence, the DSM's theory neutrality makes it irrelevant to those clinicians who do operate from theory, and the processes of conceptualizing and diagnosis become separate and unrelated entities. We are then left with many clinicians who begrudge the system, utilizing it essentially for reimbursement purposes. So here's a critique of the whole DSM. It's quite useless, frankly, is what we can guess from this text. That because in trying to be a theoretical DSM, that is, those who do prefer theory, they cannot use it because it's a-theoretical, but those who do not prefer any theories, they will still not use it. They will use it just for reimbursement purposes, as he says here. That is, to find some sort of classification to be able to do paperwork. To finish his point, the classification should stem from an informed, organized conception of the nature of the person's problem, and, deeper than that, the nature of the person's orientation to the world. personality. In the preface to his book, he summarizes this with just one sentence, the ancient injunction to physicians, as he says, "Ask not what disease the patient has, but rather who the patient is that has the disease." And from this stems one of his major contributions to the science of personology, that is, the idea that the therapy of the clinical disorder of Axis 1 should be very different depending on what personality disorder the patient has. So we have spoken about the DSM, Millon's critique of DSM, why it's good, why it's not good. I mean, we've just spoken about why it's not good. Now, I would like to talk about why evolutionary, why he calls his theory evolutionary. And to begin, again, a quote from the paper, page 28. Psychopathology, and in particular personality. Note how he says that, psychopathology and in particular personality. So the personality is what's most important. It's not what kind of depression or anxiety you have, it's about what personality you are. I said earlier that it depends on what personality disorder you have, but maybe it's even better to phrase it in a way that the patient is some sort of personality. The patient doesn't have a personality disorder. It's like a psychological makeup. It's not a clinical entity, at least that's what Millon says. Psychopathology, and in particular personality, is by definition the patterning of inter-individual variables. But the nature of these variables does not follow from the definition, but must be supplied by some principle or on some basis which is superordinate to the construct. In this model, for example, the content of personality and psychopathology are derived from evolutionary theory, a discipline which informs but exists apart from our clinical subject. So what he's saying is that he hadn't come up with a theory and then explain everything what's in the theory using the theory. He has his theory, but the superstructure of this theory, the sort of philosophical basis of why the theory is valid, is based in the evolutionary paradigm. And I'll quote further, "In and of itself, pathologic personality is a structural functional concept that refers to the intra-organismic patterning of variables. It does not in itself say what these variables are, nor can it." This might seem a bit too abstract. Let's dive into the explication of his evolutionary theory. So as he says, the evolutionary theory comprises 3 imperatives, each of which is a necessary aspect of the progress of evolution. First, each organism must survive. That's an imperative. And that's true, that's just true. It's not true because of his theory, it's just true. It's what we adopted since Darwin, that each organism must survive, and that's one of the aspects that moves the evolution. This is why he calls it superordinate structure, because it's not provided by his theory. It's just it's just something that's at this point is a common knowledge. It's just a general truth that each organism must survive. It must also adapt to its environment, and it must reproduce. So the general evolutionary theses. I will quote page 29 of the paper. Each of these imperatives relates to a polarity, allowing for its expression in the individual's life. To survive, an organism seeks to maximize pleasure and minimize pain. That's the polarity. To maximize pleasure or enhance life circumstances, or minimize pain, or in other words, avoid dangerous or threatening stimuli. To adapt, an organism must, at appropriate times, either the polarity, either passively conform to or actively reform the surrounding environment's constraints and opportunities. And finally, the third imperative. To regenerate, an organism must adopt either a self-oriented or other-oriented strategy, judiciously choosing, in quotes, to self-invest or nurture other significant organisms. That's this polarity. You would choose, in quotes, to self-invest or to nurture other significant organisms. And the finish of the quote: anywhere in the universe, these are the fundamental evolutionary concerns, and there are none more fundamental. I would like to finish this by a short reiteration and then some quotes and some plan for the further discussions. First of all, we always classify everything and everyone, and in doing so we had better use good methods to do good science, to be more efficient, less biased. We talked about how the DSM is not perfect, and we talked about some of the dangers of adhering too much to a classification, as well as being too eclectic, abandoning classification altogether. And I said why evolutionary approach is in access to all the other perspectives. I also said that his great innovation was that the idea of treating clinical syndromes of axis 1 based on axis 2 personality disorder. In the further discussions, I will talk about all these spectra of personalities, which there are 15 of, that he derived from his theory, and I'll be using his third edition book, The Disorders of Personality. And just one last thing about the book, as he says himself that the most innovative section in each clinical chapter concerns personality spectra subcategories ranging from childhood variants to normal styles to abnormal types to clinical disorders. So again, as I said in the very beginning, that's why I like his approach out of all the others that I'm familiar with, is that he creates this very smooth transition from childhood variants, normal styles, abnormal types, going into the clinical disorder. I hope this made some sense, and if you're interested in his theory, I hope you'll enjoy watching the next videos, and see you next time. Conceptualized and treated very differently